add to it, add to the question. So there's the vaccine rollout. There's also, and its precursor where we learned a lot of lessons was we had to get a provincial lab network up and running very, very rapidly. And so just a little bit of context for everybody in Ontario, because we have 45 separate labs up until the point of the pandemic, they were not connected. And so we had to move very, very rapidly. And when we think about the lab network, if you step back from that for a moment, and you mentioned the sleeve, rolling up your sleeve, and vaccine is very similar, right? We learned much of our lessons through the lab thing, but vaccine was very similar. First off, there's the acquisition, right? And so in the case of lab, that means that's when you're getting swabbed. Then there's transportation. We've got to get that swab somewhere to a lab to be tested, and then that has to be uploaded onto a server, onto a database. And then from there, the result has to be communicated out. And of course, everybody wants to communicate it out onto their phone. And you're starting with largely a paper process at the front end, and mainly a paper process. And this is true again of vaccine, because we have to, anytime that in healthcare, an added sort of element to what we do is we have to make sure that we're providing equitable access. So we can't assume that the person at the front end of this has a smartphone. They may not. So we had to map all of those processes through and then bring the system up. When we had to speak to decision makers, in this case, elected officials and other government officials, we had to explain to them the risks that we're going to have to take when you're trading off for speed, right? Where we had to take a big sacrifice, and it actually did come back to haunt us a little bit on the system, is that we had to compromise at capture. And we did not have a lot of security at the capture level, and we did have a breach, but it was at the capture level, not at the data management level. Through data management, we were able to determine that we had a breach, but that's where we had to take it. But again, because of speed, we just had to balance those probabilities and say we may have some problems at the front end, put some tools in the back again to try to secure the environment. But at the end of the day, you're weighing what's the better public good here, and getting whether it's the lab system or the vaccine system, getting them up and running quickly was worth taking the risk of a little bit of an unsecure capture stage. And then just do back end to see if you can sort of offset it and mitigate it. And largely we did. We've heard expressions like perfection is the enemy of progress and all that kind of stuff. And in these instances, that was absolutely true, right? And so, those risks that we had to take when we brought the systems live, they've since been corrected.